welcome you all in this module of Panchakarma. In today's module, we will discuss about the clinical application of Kashaya Basti. I am Dr. Rajkala Patil, Head and Associate Department of Panchakarma, Faculty of Ayurveda, IMS, BHU. So, what is Basti? Of course, Basti is not the enema, it is the therapeutic medicated enema which is used in Ayurveda as a Basti. Why the name is Basti is Bastina diyate iti Basti. In the previous time, in the olden days or in ancient time, as there was no invention of plastics or polythenes, they used the bladder of animals to administer the Basti. That's why it is called the Bastina diyate iti Basti, the administration of liquid medicines through rectal or urethral or vaginal route is collectively called the Basti. Dvidho typa Basti, there are the two types of Basti, one is the Niruha and one is the Snehik. Sadosha Nirharanat, Sharira Dosha Haranat Niruha. The Basti which eliminates the dosha and cures the disease is called the Niruha. Vayasthapanad, Ayusthapanad, Va Asthapanam. The other name of Kashaya Basti is Asthapana also. Why? It refers to the maintenance and prolongation of the life. And for Anuvasana, Anuvasanam apicha dushyati anudivasam va diyate iti na dushyati anudivasam va diyate iti anuvasanam. The Basti which can be administered every day regularly with no risk of complication. That's why the name Anuvasana is there for Basti. When Basti is concerned, it comes under the Asthapana or Niroha Basti only. Basti Vataharanam Sreshtam. Almost all acharyas consider Basti as a half or whole of the entire therapeutic measures and advocated best and quickest way to provide strength and immunity to even children and old people also. Mostly other panchakarmas like Vamana, Virechana cannot be easily practiced in the old age people or in the children. But Basti can be administered in old age also and in the children also. That's why it is the best way and quickest method to get the immunity in the old age and the children. So this is the time to provide attention to Basti in present research era and to develop current advanced modalities for the Basti. So, classical classification of Basti is based on the Adhisthana or where we administer the Basti, that is called the Adhisthana, Pakvashayagata Basti, Garbhashayagata Basti, Mutragata Basti or Vranagata Basti. For Pakvashayagata Basti, we usually say Niruha or Anuvasana. For Garbhashayagat and Mutrashayagat Basti, we called as a Uttara Basti, and Vranagat is called the Vrana Basti. Based on the action, Sushruta defines the action of Basti as a Shodhana, Lekhana Basti, Snehana Basti or Brahana Basti, and Vagbhata says Utkleshana Basti, Doshahara Basti and Shamana Basti. According to the Anushangika Bhedena, these are the types of Basti: Yapana Basti, Yuktaratha Basti, Siddha Basti, Madhu Tailik Basti, Prasrut Yogic Basti, Dwadash Prasrut Basti, Padahina Basti. Based on the composition, Anuvasana, Sneha Basti, where the Basti Dravya is Taila, Grita or Majja, this is called the Anuvasana or Sneha Basti, and when the main content of the Basti is decoction, then it called as a Niruha or Asthapana Basti. And these are the names of the Basti according to the specific indication, that is Pramehara Basti, Visarpahara Basti, Raktapittahara Basti, Kushtahara Basti, Vatraktahara Basti, Gulmahara Basti, Abhishandahara Basti, Krimihara Basti, Dahagna Basti, Mutrakushtahara Basti, Parikartikahara Basti. These are the specific actions of the Basti which are used in the specific conditions. On the basis of nature of the Basti Dravya, it says like Mrudu Basti, Madhyam Basti, Tikshna Basti, like Trifala or Lekhana Basti comes under Tikshna Basti, Vaitaran Kshar Basti comes under Tikshna Basti. In Dashamul Niruha comes under Madhyam Madhyama Basti, and Kshir Basti comes under Mrudu Basti. Based on the number of Basti, when there is 30 numbers, we called as a Karma Basti, 15 numbers called as a Kala Basti, when it is only 8 numbers called as a Yoga Basti. And these are the different numbers of Sneha and Niruha, in particular Karma, Kal and Yoga Basti. In Karma Basti, 18 Sneha and 12 Niruhas are there. It is used in the chronic condition and Vata predominance diseases. In Kala Basti, 9 Sneha Bastis are there and 6 Niruhas are there, which are done alternately, and it indicated in the Pitta predominance diseases. And in Yoga Basti, 8 Bastis are there. Among that, 3 are the Niruha Basti, others are the Sneha Basti. These are indicated in the Kapha Dosha predominance diseases. Coming to the Niruha, Niruha is the procedure where the combination of medicaments are administered through rectal route for the local as well as systematic effect. Depending on the dose and nature of the ingredients, Niruha is of several types like Kshira Basti, Yapan Basti, Madhutailik Basti, Vaitran Basti, etc. And the indications of Niruha are Sarvanga Roga, like neurological disorders involving the whole body, like paralysis, Parkinsonism, is indicated for Niruha. Ekanga Roga, like Bell's palsy, this is also indication of Niruha. Vata Sangha, or obstruction of the passage of flatus. Mutra Sangha, Mala Sangha, Shukra Sangha, Mudha Garva, and in pregnancy to induce the uh, normal delivery. In 9 month also we practice the Niruha. Balakshaya, whenever there is physical strength is less, Mamsakshaya, emaciation is there, Shukrakshaya is there, Anga Supti, that is numbness in the body parts, Hridrega, Katishula, Rajakshma, Vatrakta, Ashmari. In these conditions also we do the or Basti is indicated. Practical indications are neurological diseases, rheumatoid syndrome or other arthropathy, low back ache with various etiology or pathologies, peripheral vascular disorders, ulcerative colitis, IBS, infertility, male or female. In all the conditions, Basti is the solution or Basti is indicated. And these are the contraindications which are Panchakarma physician should be very specific regarding the contraindications of Basti. In Ajirna, if we do the Basti in Ajirna, it leads to the Duschodara. In Pita Sneha, if we are doing the Basti, it may leads to Shotha. In Murcha, Alpagni, Ati Dorbala, Utlishta Dosha, Shudharta, Vamit, those who have undergone the Vamana, Murchita, those who have already having Murcha, Kasa Prasakta or Shwasa Prasakta, that is status asthmaticus, Kushtha, Arsha, Shunapayu, if there is inflammation in the anus, these all are the contraindication, or in these all conditions we cannot do the Basti. The material required for the Basti is mortar and pestle, Basti Nitra, polythene cover for at least 1.5 liter quantity or capacity, and traditional Basti Putaka. Hot water, utensil, good quantity of fine sieve, cotton towel, measuring apparatus, cotton thread to tie the Basti Nitra, cotton, sterile glove, oil for Abhyanga, medicaments as per prescribed for the required Basti or required quantity, and one churner to make the Basti Khajena Mathita. This is the Basti Netra, or the procedure whole we will see in the next video. The preparation of Basti Dravya, initially Sendava is put in the Khalva Yantra and it is powdered well. Then Madhu is added in thin stream, trituring properly to make a homogeneous mixture. It is followed by the mixing of appropriate taila in required quantity mentioned in the mixture slowly by the side of the mortar, and it is continuously stirred until it attains a uniform consistency. The kalka, which is fine paste of drug mentioned in the yoga, is added little by little along with proper grinding and grinding with pestle. Then appropriate kvatha is required amount as per yoga is added slowly and properly mixed filtered kvatha. The avapa, if mentioned, in the yoga, if needed, is added at the last, followed by proper steering. The mixture is filtered through a fine sieve and finally made lukewarm sukhoshna by keeping over a hot water bath. This mixture is churned well with the help of a churner. When it is a lukewarm and comfortable for the patient, it is transferred to a plastic cover, that is Basti Putaka, having sufficient thickness, and then Basti Netra or bronze nozzle or plastic is tied to it very well with plugging the other tip with a cotton varti to avoid the spoiling of the Basti. Then when to administer the Niruha Basti. In text it is beautifully, it has written like Madhyane Kinchit Avarte Na Ati Bubhukshita is the ideal time of administration for Niruha. So they have not written morning 8 o'clock, 7 o'clock, 10 o'clock, 12 o'clock, because whenever the physician, Panchakarma physician gets such condition in the surrounding environment, he should administer the Niruha. This time varies depending on the Desha and Kala, as it generally comes in between the 9 to 11 am. Purvakarma of Niruha, the procedure is usually done in empty stomach. Those who are Sukumara and Kshina are asked to take very light food in early morning. Abhyanga and Sweda done over lower abdomen and lower back, that is Kati and Parshva Pradesha. Sarvanga Abhyanga and Sweda can be done before the procedure if it is advisable or feasible. Then Pradhan Karma, position of the patient, it should be as we can see in the picture. The patient should lie on the cot of knee height. For Basti, knee height table should be chosen in left lateral position. His or her left lower limb extended and right lower limb flexed at knee and hip. His or her left upper limb should be kept under the or folded under his head. Important is, this is the Sims position. It is important that in this position we get the ready access, proper visualization, allowing medicine to reach a sigmoid colon. In procedure, a small amount of plain ghee or medicated oil should be smeared over the tip of the Basti Netra as well as the anus of the patient for lubrication. Wearing the hand gloves per rectal examination should be carried out to rule out loaded rectum or any other obstruction. Hold the Basti Netra in the left hand and Putaka in the right hand and remove the plug from the tip of the Basti Netra and evacuate the air. Close the tip with the left index finger, and then we will insert the left finger Basti Netra in the gently introduced into the anus, and Putaka is pressed slowly in a steadily to push the Basti Dravya into the patient's rectum. Patient is asked to count up to 30, 1, 2, 3, 4 like that, and to breathe deeply through the mouth during keeping the mouth open during the introduction. Basti Netra is withdrawn with a little amount of medicament remained in the Putaka to avoid the entry of air. If the patient feels the urge of defecation during the procedure, he is allowed to pass stool after removing the Basti Netra, and remaining medicine should be administered later. Paschat Karma is, patient is asked to lie in supine position till the urge for defecation occurs. He or she asked to clear the bowel as many times he feels vega and advised to take bath in lukewarm water. Then diet according to the dosha visheshan and satmya should be advised, preferably rice with mudgaisha or mamsarasa can be given or can be advised. Blood pressure, pulse rate and time of retention, number of evacuation, and if any discomfort observed should be noted. He or she may be asked to take rest and light food is given at the night. These are the complications which we get in the Niruha Basti and their management. Abdominal discomfort and pain after careful evacuation about the cause of appropriate management can be adopted. General measures like Abhyanga, Sweda, Dipana, Anulomana drugs are advisable. Immediate evacuation without retention. Another basti with less lavana, ushna and quantity should be administered immediately after ruling out the sphincteral incontinence. Giddiness, low pulse, low extremities, cold extremities and delirium may occur. In such condition, console the patient. Foot hand elevation should be done. Hot drinks should be given to the patient. Warming extremities. Drugs like Siddhamakardhwaja, Drakshadi Kashaya, Dhanvantaram Gulika, etc. can be given. Sometimes vomiting may happen, usually subsides without specific management. Drugs like Chandrakala Ras, Dhanvantar Gulika, Drakshadi Kashaya or Mayur Pichha Bhasma can be given. If patient feels the anaphylactic reaction like skin eruption, itching, urticaria, dyspnea, careful history taking should be done to identify known allergen and avoiding them. Haridra Khanda Trikatu with Sita, Sitopladi, Chandanasav or Draksharishta can be given. Long retention, if there is a complication, known cause like obstruction of anal canal, bipile mass, enlarged prostate, fecal matter, etc. should be excluded, or in such cases, rubber catheter or rubber tube or specific Gudavarti can be introduced into anal canal to evacuate the basti. Okay, this basti is masked with the stigma of phobia. Mostly this is a very easy procedure, but patient feel it's a dangerous procedure because it is difficult to do. For patient it is very uncomfortable, prone for complication. If there is any incorrect procedure, if there is any faulty instrument or if there is the choice of drug is not proper, it may lead to the complication. So the reduction risk of complication we can do by the standardization of procedure, standardization of equipments and standardization of the drugs. So for equipment we can use the disposable, sterile, easy to clean, reusable, which are more prone for the injury and there is no risk for no eco-friendly that can be used. And for the standardization of drugs, of course, the ready-made kashayas are dangerous during the basti. It should be freshly prepared kashaya. Dried whole extract of kashaya can be used. Avoiding complication, assessment of temperature by thermometer should be done and pH, specific gravity, volume, viscosity, objectively accessible. Environmental conditions in consideration should be taken, like if it is summer season the temperature of the basti should be less, if it is a winter season temperature of the basti can be increased. Attitude of physician and Panchakarma attendant is very important in the in Kashaya Basti. So here are some clinical observations which I have done within this 20 years with the Niroha Basti. What we get better result in the renal calculi if it is of 7 to 8 mm during the 7 to 8 days of Vyatyasat Basti, Niroha and Anuvasana, it comes out as a 8 mm of renal calculi. So it is very effective in calculi. Spinal injury, when the patient was bedridden and when we administer the basti, the patient could walk with walker, and after completion of the whole panchakarma, she can walk without any support. So in backache patients also, basti give the miraculous results. In renal failure also, I remember many patients we have done, but a patient with creatinine at 4 and that patient the creatinine level comes normal with the Vrukka Shothara Basti or Basti which acts on the Vrukka or Ashmari Shodhanahar Basti which we give in the renal failure patient. The creatinine reduced as a 1.2 and in the patient in BHO only we have done, the patient is having creatinine 6.6 and we did the Vrukka Shothar Basti or Shothar Basti in that. Since I think 4 months or 6 months, 4 months, the creatinine is as maintained in the level 6 only. In pancreatitis also, chronic pancreatitis, Basti gives the better result as we cannot do the Vamana and Virechana in such patient. With Prameha Basti, we are getting good control on the diabetes without giving any insulin. In rheumatoid arthritis also, Basti is a very good solution for the pain and inflammation. And of course, Vaitana is a kind of Niroha Basti which is giving very better result in the Amavasya also. With this, thank you all for listening about the Niroha Basti.